Here we go. We have our today's chief guest, Maya BHATTARAI. So I would like to bring her in today. And thank you so much for coming in our studio. And why don't you explore yourself about your testimony and what you do today?
Yes, it's been my honor. Thank you so much for this opportunity here today. Hello, everyone. My name is Maya Batrai. I'm a mom, I'm a wife, and I'm a friend. I am a functional medicine certified family nurse practitioner by training. And I'm a founder and CEO of Cherish Functional Wellness, which is a telehealth platform where I do functional medicine, lifestyle consultation all over United States.
Wow, there we go. So why don't you explore more about it? Like, what is functional medication and what inspired you to pursue a career degree towards that?
Yeah. So, so functional medicine, it may be a new term for a lot of people, but this is not a new concept. It's been going on for many, many years, actually. So if I would, just define what functional medicine is. So functional medicine is really dedicated to really understanding the root causes of chronic illnesses and restoration of health and well-being. And we do so by really removing the imbalances and bringing on the balances in our body. And functional medicine is the science and art where we really try to, do the health and healing differently when it comes to chronic illnesses.
Well, I know as we serve in the community in the conventional medication system, as we welcome our patient in the clinic, like we do assess them physically, head to toe assessment, and also the patient order the labs, and after the diagnosis, we provide them treatment with the different drugs and anything else. But why don't you tell our listener about the difference between the functional medicine and the conventional medicine too?
Yes, yes. So before before entering into functional medicine world, I graduated with my master's in family medicine. I mean, family nurse practitioner. In back in 2013, I worked in urgent care setting, and also in the primary care setting, and I was providing the care. However, my really desire was to really provide holistic, you know, care to the people, and therefore I made this shift to more functional medicine, and so I got further training in functional medicine through Institute of functional medicine, and it took me about 2 years. That's the minimum. You can like go further, but I was able to finish it in about 2 years. So that's why I pursue functional medicine. So when it comes to the difference, so I think that we all have some level of experience with functional medicine, in form or shape. So with functional medicine, the difference is there are few. So I would like to take some time here. So let me start with the example. Like we all can picture apple tree, right? The apple tree has roots. It has the big trunk. It has branches, and then in branches we have like leaves, and then the fruits. So in the same way, let's picture ourselves as a tree, right? So if we picture ourselves as a tree, and so if we are sick, so in a conventional world, what happens is like we go to the primary care, and if sickness is not really gone, then we are referred to a specialist. So like maybe neurology, right, or the immunology, or your endocrinologist, cardiologist, based on your illness. So when you look into the tree, so all those specialty are like the branches, and so people who are providing those cares are specialized, and they know, and they really focus on that particular aspect of health. However, when it comes to functional medicine, we not only look at just that particular branch, but we actually look at the whole tree. So we are looking at the roots, we are looking at the whole trunk and the branches and the leaves and the fruits. So because functional medicine is not like looking at one organ or system. We know, like our body has different systems, right? So they say the circulatory system, right, the respiratory system, um, But in functional medicine, we are looking at everything because in our body, everything is connected. And this is so fascinating because everything is connected. So, for example, if somebody comes to me, let's say, with autoimmune condition, right? I mean, it's like very prevalent these days all over the world. I am really looking at their gut health. I'm looking at their immune system, of course. I'm also looking at their, the energy level. So looking really into the mitochondria, the ATP, right, the energy
Wow.
production. I'll be looking at even the communication, which is the hormone, and elimination, So all those aspects to, give you some, some of the list. So so that's why it's like very holistic because we appreciate the fact that our body is connected. So that's one way. And then when I say holistic, we are also looking at the physical, mental, emotional, spiritual, and the social aspect of health because all of those really affect our health and well-being. The other thing we really are like a little different is it's very comprehensive and it's very personalized. So if two people come to me with the symptoms and let's say a diagnosis of headache, because there are so many factors that has contributed to the headache for one person, and then there may be different factors for another person. So my approach for even like taking care of headaches may be very different based on their situation. So this is very comprehensive. This is very personalized. Like conventional medicine is great. It has its great strength when it comes to managing acute symptoms, right? Like the infections or the trauma or the surgery. And we must be, and we are very thankful for those kind of interventions because
Wow.
they are like life saving. So functional medicine more for the chronic cases, chronic issues. So the examples could be, if somebody is like, keep having some kind of infection frequently, then, I mean, we do probably need to use antibiotic if it's needed. But then, I think like it's wise to go further and then really look into the root cause why, you're having these frequent infections, like, more than say.
Yeah, absolutely.
And then the chronic conditions, I'm referring to are like the, autoimmune conditions, your thyroid, your maybe high cholesterol, blood pressure, So those are the things we are really referring to when it comes to chronic conditions. Like in United States, 6 out of 10 adults have at least one chronic condition. And then 4 out of 10 have 2 or more chronic conditions. And so I think like functional medicine really bridges that gap when it comes to, really helping, bring healing when it comes to chronic conditions. And we use lifestyle modification as the foundation, and which is really not expensive, really. And so research has found that about 80% of our symptoms can be really be diminished if we really make some changes when it comes to lifestyle changes, and that is very powerful and really empowering research findings. The other thing it's the different is like with functional medicine we are really spending a lot of time with patients, and I typically spend like about 75 minutes in my first intake visit, and a lot of history taking, and we go all the way back to when the person was in mother's womb, all the way through at this point. So that could be like how was the birth, was it breastfed or the bottle fed, the formula, or like what kind of diet, and what kind of environment, social, aspects, all of those things, because all those factors really also determine the health. And then one more I would add would be, like the way we look at the labs. So a lot of times, we maybe just like waiting and watching, before your blood work, right?
Yeah.
The labs are like, you are normal, and then abnormal. However, we look at the even conventional lab in a functional lens because we want to optimize the health, and
Oh.
we want to prevent the illnesses beforehand. So we take it, even the lab readings a little differently. So that's how it's like, different. It's a long answer, but I think you got the gist of how it is different from conventional medicine.
Wow, it's amazing, right? Well, I'm not only surprised, but I'm excited to even explore more. So, Sister Maya, why don't you tell a little about I thank God for having you here because you also talk about being holistic health through conventional medication. Functional medicine, right? So you also explore about an example of trees like having trunk, leaf, branches, root, which is great. Like human body is made in such a special way by God Himself that we have been created in His own image. And also, we have a lot of like systems, like you talk about respiratory, like about endocrine system. Even there are a lot of systems in our body. So I know you one time you also picked the word like there's a these medicines talk about bringing all things in the balance from the imbalance, right? So what does cause imbalance in our body? Can you tell me a little bit about it?
Yeah, that's a very good question. I mean, there are so many factors, right, that can bring imbalance. But if I have to really summarize in one word, it's going to be inflammation.
Oh.
Yeah. So, inflammation, we know that, when we have some injuries, from externally, our skin may be red, a little bit of swelling and, pain. So that's the sign of inflammation externally. However, there is some inflammation going on inside as well. I mean, when I think of inflammation, I think of fire, right? And so there's some fire going on inside our body, and it's a slow killer. We may not be aware of it, but it's a slow killer. And the sources of inflammation are, the stress, chronic stress. If we are having a poor diet, right, unhealthy choices of diet, it could be because you had some, chronic infections, maybe parasites. It could be because you've been taking, like a lot of antibiotics all through your life, a lot of maybe Tylenol, ibuprofen, or like acid reflux is one of like very, very common, issue. And if people are taking, let's say, omeprazole, birth control pills, like all of those things can have impact in our body. It could be that people may have like some kind of, food allergies or sensitivity, and they are unaware of it, and they keep eating that. But it's like really having those, slow inflammation. There's something called dysbiosis. I mean, there been so much research going on in functional medicine world. So with the dysbiosis, just to give you an idea, so we are, we have like a lot of microbiome, microbes, microorganisms in our,
Right.
body. And so they are like the bacteria, the viruses, fungi, all of those things. And there should be the balance, let's say the good bacteria and, and then bad bacteria. I mean, that's also called pathogenic, which can cause harm. And there should be the balance, and there should be the friendship. But when there is like, imbalance, more of pathogenic and less of the good bacteria, then there is a dysbiosis, and that in itself can also cause issues. And so, yeah, those are some of the examples of the toxins. And also that we live in the environment like where, if you're exposed to, like air pollution because we live near the factory, or the water is, contaminated, or like with the toxins and things of that nature, or we are using certain chemicals in our house, even like, we may be thinking that, oh, we are like cleaning the, kitchen with some, chemicals, thinking that we are, killing the germs, but at the same time, it may be too chemical that, is not good for us. So there are like a lot of sources of toxins and inflammation. And if we can really remove those and, bring some balance on, it's just like the very simple and easy way of like, really getting into the functional wellness in your health.
For example, like when someone has like more like glucose in the body,
Yeah.
when the pancreas not able to produce insulin enough, then one has diabetes, right?
Yeah.
Similarly, so functional medicine is all about like bringing a balance in our body between pathogens and the bacteria, right? That's great news.
Yeah, so that's one of the things. Yeah.
Well, and also like you also mentioned one time, like functional medicines is doing something greater than conventional medication. Well, can you also tell me or tell our audience about where is the place where functional medicine impacts significantly in the patient health?
Yeah, I mean, it's, like I mentioned, I mean, conventional medicine has its own place. We need them. We are so thankful for them, right? And I use conventional medicine, Rome, if I really need in some of the occasions. So where functional medicine really shines is one is really when we are really trying to, you know, be cured of, or at least, really minimize, the chronic conditions. Like it works fantastically when it's like for autoimmune conditions, for your diabetes, your cholesterol, like obesity, things of that nature, right? Like even hormonal issues, PCOS, um, like rash, like eczema, psoriasis, those are the things that are like great. But it is also very, very helpful in preventing illnesses.
Okay.
So based on like your lifestyle, your maybe genetic risk factors, even like some of the blood markers that you have currently, we can take a look and we can actually predict, what may happen in next 5 years or 10 years if you do not change, if you do not do something about it. And so it is also really, the medicine is a science where we can like prevent illnesses and really promote health and really optimize your health, and really for the vitality. Yes.
Wow. There we go. Well, and also I heard like, is there any situation or do you have any testimony that when you treat our poor patient through functional medication that they're being healed completely without any side effects?
Yes, yes. I actually do have a lot of testimonial, and I get surprised myself as well. I'm like, oh my goodness, she got better. So I mean, the one patient comes to my mind, and I'm gonna name her as Molly. And so Molly came to me with this history of autoimmune conditions. Yeah, she was just in the early 30s, and she, has history of rheumatoid arthritis, ankylosing spondylitis, and hypothyroidism.
Oh.
And she had been to a specialist, rheumatologist, and she also because she had like this severe joint pain,
Oh
especially
no.
back pain, and she's very smart and used to work, couldn't go to work because she had like hard time waking up in the morning because of the severe back pain, just back locked up, very fatigued, right? And she couldn't do a lot, missing work and all of those things. And she was also taking different medicine, like including this Enbrel, Remicade, Humira. They are like the IV and the IM and the sub-Q, way of getting the medications. But she was not feeling better, and she actually had the side effect from those medications, with the gut and stuff, with like a lot of diarrhea and things of that nature. So after she was like, had tried everything, and she came to me, and we sat down and really tried to listen to her and really, see where things were, and trying to understand why, what's the root causes. And so even in the first visit, after the first visit, I recommended some of the lifestyle factors that, maybe that's going to be helpful for her, just based on her, like the history, the lifestyle, and then also some of the risk factors. And like she got better, like, even with the lifestyle changes. So we said, okay, how about we, remove the gluten, which is mostly found in the wheat. It's a protein that's found in the wheat, barley, and rye most of the time, as commonly, but there may be others, protein as well. And then sugar and dairy, and eggs, just as few, without even doing the testing. And she tried that, and I think like in about 3 weeks she was feeling a little better. Her joint pain was better. And then with when we had the blood work and the stool test results came back, then we really targeted with more personalized supplements, and also the food as medicine and all of those things. And so in about less than 4 months, she had like slowly tapered down her Humira.
Wow.
And less than 4 months, one day she came and like I am off of Humira. I'm like,
There you go.
what? And so then she has never been back to those medications. So we are like continually optimizing, like, okay, how can we make this better? Okay, what else can we do? Are there any toxins? Are there any like hormonal aspect we need to look at? Is your gut healing well now? So all of those things. So step by step, she's doing just fantastic, and no side effects really. And that was a kind of like really autoimmune, which can be very extreme, and she did heal. So that's a wonderful testimonial. The another one, I would tell you the common one. So a common one, acid reflux, right? Like a
Yeah.
lot of people suffer with acid reflux.
Yeah.
So I'm gonna call her Lisa. Lisa, she was suffering from like acid reflux on a daily basis, and also anxiety and some panic attack for over 2 years. She been to the GI doctor, did the testing, endoscopy, like all the testing, and everything came normal, except she had like some, lower sphincter relaxation. But basically, the plan for her was, take your medication, Pepcid or Tums when you need it, maybe some, diet changes, but probably I think like she didn't get like very specifics of what kind. And so she came to me, and again, the same thing, right? Just listening, understanding, what are some of the factors. And so we worked together, and in about 10 weeks, she reported that she doesn't have any anxiety anymore.
Wow.
And then her, acid reflux had significantly been better. She sometimes have nighttime acid reflux based on what she's eating. But she knows, what things trigger. So that's very empowering to her. She knows what, supplements she needs to take, because I educate all through this process. And so, yeah, she's happy. And I also do the tracking, like, okay, before we start, working with you, and then, let's work something, and let's do some survey of, how you're doing with the symptom. And then, and then the higher the score means that, oh, you're suffering, it's not good. And then lower means like you are in the, better place now. So her score when she started, it was 100. So which is like severe. And then about 6 to 7 weeks, we, did this survey again, like the symptom based, and it was 30. And then about 10 weeks we did again, and then it was just 13. So, she has been significantly improving. She's not taking Pepsi. She's not taking any, anxiety meds or any of those things. So, and she's feeling much, much better. And I think like we can even do more. But these are just some examples how functional medicine can really, help you.
Wow. It seems like a new wine in an old jar. Because I know I remember still those days before, like, let us say 40 years back in the country called Bhutan. We had no any medicines. We had no any clinic. Our parents were like a surgeon. They used to do everything by themselves, and when we didn't have to take any pills. But today, like, I know we are under a bunch of pills and treatment plans. Still people are sick and have been struggling with different problems and health issues. But why don't you tell us, our listener, about like, is there any good changes in our lifestyle, like nutrition, sleep patterns, and also like eating habits? Is there any changes that functional medicine have been recommending for?
Oh, yes. So like I mentioned, like lifestyle changes are the foundation. We start with that. And so the food, is the number one thing, we do, of course. So, when it comes to food, I mean, you might have this saying, food is medicine. So I would say, food can be a good medicine or food can be a bad medicine. So if you are eating unhealthy food, right? The fries, right? Or the
Yeah.
pizzas, regular basis, that's going to be a bad medicine for you. But if you're eating healthy, fruits and vegetables, protein and nuts and seeds and, things of that nature, then, you're really getting the nutrients you need. And so it's a good medicine. So food is medicine and food is also information. So when you're eating unhealthy, those toxic, those, food that has been maybe fried in not so healthy oil and, packaged food
Mm-hmm.
or like your sodas. And
Yeah.
that's the information you are really giving to the cells of your body.
Mm-hmm.
And so it's going to receive it and it's going to convert to the message inflammation. It would
Mm-hmm.
be the message that it's
Yeah.
going to gain. Versus when you're eating the healthy foods, then it will be, anti-inflammatory.
Mm-hmm.
So food is, and there's also whole science behind also mindful eating. It's just not about the eat, but then how you're eating, how many times you're chewing, and then all of those things, just the mindful eating is another, new topic as well. So that's one thing. The other aspect is sleep, right? So I mean,
Mm-hmm.
sleep is so important, and I think like that's been a chronic issue these days because of how busy we are and this. Just like having technology, right? The phones in our hand, and so we need like 7 to 9 hours of sleep every night,
Yeah.
just for the restoration of our brain and body. And it's like so important. And one of the major reason why people are fatigued, they're tired, are because of not having enough sleep, that restoration time. And joyful movement, right? So joyful movement could be anything from, like, if you like to dance, if you want to go for a walk, jogging, or go to the gym and do some exercise, stretching. Any form of that is so important to your health, and it's just going to bring overall, wellness. um, and then, no, stress management, right? We are in this world, everybody is stressed.
Yeah.
And so, like managing stress, and I mean, if there are the sources that you can take it out, that's awesome. But if you cannot, maybe like just how to manage the stress, maybe again, you go for a walk or journaling, prayer, sharing. So it's not really, in your heart. All of those things are so important. And then the next one is the relationship. And
Mm-hmm.
so I call it, relationship. If you are someone, who has faith in the universe, God, then, just your relationship with God, but also relationship with others, right? So your family, your friends, coworkers. And so those are like the five foundational. I mean, there are others too, but like, just to name few, those are the most important five lifestyle factors that, like, I emphasize, and you can also use those in your life and, see some changes starting today.
Yeah, absolutely. Well, Sister Maya, I also like heard about like to our poorest of the poor community, like functional medication has been providing good services. But are there any better services, a treatment plan for our good listener today? And I know as we take the meals, we call chymes when it's mixed with saliva and goes GI tracts all the way down to our tummy and small intestines, figure out in
Mm-hmm.
duodenum and get exit through the
Yeah.
GI body. But before that, I know we have a metabolic system in our liver, and then good stuff has to be there, and then bad has to go exit from our body, right?
Mm-hmm.
So as we do those process, like, are there any better like treatment plan through our functional medication?
Yeah, there are like, and it's like very personalized. So,
Hmm.
yeah, so, whatever I talk, by the way, so it's a
Hmm.
disclaimer, it's not any treatment advice. It's just for the educational purpose
Hmm.
of this whole entire, podcast interview. And so, yeah, there are a lot of things we can do. Like, one thing we just talked about is the lifestyle thing, right?
Hmm.
Even like choosing the healthy foods. The
Absolutely.
other thing is like just a mindful eating,
Hmm.
And then also chewing. I mean, we are in such a hurry that we just don't chew enough. I mean, like we should be chewing about like 25 times
Wow.
for a bite of food when you take in. Then you chew about 25 times, and then the food gets in, and then as far as the digestion and absorption, like you could really help with that with some digestive enzymes, some pancreatic enzymes, things of that nature. So yeah, definitely we can help with that. And liver has like over 500 functions, and if your liver is not functioning well, so that can be another issue too. And there are things you can do really to even like and the number one thing that liver does is like detoxification, right? And so we can help just from our lifestyle choices, just helping with that detoxification. But there are also like there are supplements that we can recommend to really speed up, that open up that phase 1, phase 2, and also phase 2.5, phase detoxification. So there are a lot of things we can really do. I'm somebody, if we have let's say their gallbladder has been removed, but we do need bile salts for fat, breakdown and all of those processes. And so we can give something that's going to help externally too. So of course, so lifestyle is the thing, but also we can supplement to make things work easier. So helping really body, because our body is really made in such a way that it has innate ability to heal itself when given the right environment. So what we do as a practitioner is like we are just offering, we are just giving those beneficial things, that needed thing to the body, so the body has all the things it needs to heal and do its job, do its function. So
Wow. Well, finally, as we're listening and watching today, like Sister Maya, do you also provide some information or your contact, like email, or how can we contact you to get help from the functional medication treatment plan or services that we will be getting in future or even in present? So would you like to explore a little bit of your contact information, about your email ID? How can we contact
yeah,
you?
yeah, absolutely. So so with Cherish Functional Wellness, it's a little bit different. So I do offer one-on-one service. I do offer like annual membership. I do offer like 3 months or even 6 months, really trying to meet, where people are, what's their need are. Some people really want result in, less time, right? So then, okay, let's work on it. And then we are very result driven. And so then we work together, like, and then we get the results within 3 months.
Wow.
And some things, some health conditions, there are, if there are like, few of the chronic health conditions, then it's going to take time, because we are not a quick and easy fix medicine, and it's going to take time. And we are, again, like giving the body what it needs, but it also takes time, right? The body takes time to heal. And so those are some of the ways that I do. The goals of really like at Cherish is like really, removing the illnesses and bringing the wellness, and doing health and wellness differently, which is the functional medicine, the cellular healing, where I really go into the cellular level, really bringing health and well-being in the cellular level. The other thing I really love to do, and I'm trying to do, is do the health and wellness in the group setting.
Okay.
So that could be like, like group setting would be like at the church setting, let's say, any organization. If there is a mom's group, or like, dad's group or youth group, it could be, like at church, if, or any faith organization, or any business organization, if they want to do health and wellness together, in a group in a certain time frame, let's say a month or 2 or 3, then I bring wellness, so what I do is like I really bring education, because people are really lacking education. They are not aware of, like I mentioned, like 80% of symptoms will be gone if we can leverage this lifestyle. But why people are not doing it? One, they are not aware, and the next, they do not have the accountability, the coaching, right? I need somebody to coach me and be accountable. Even though I have the knowledge, right? I need somebody to make me accountable. So the coaching part. So I provide education. So like that is a big part of Cherish. We provide, educational learning modules for people as a part of the service, and then coaching, guidance, just being accountable, and so that people are consistent with, making some of those changes, because making changes is difficult. It is difficult. It may sound easy, but it's difficult. And so that, and then really bringing wellness in a group setting. So, like the in the church setting, if there are staffs and the volunteers and the family, they come together and they want to do some kind of wellness together. Great, I'm here. And so if the moms group want to do something together, for a month or two, great, I'm here. So that's like little different way that I serve the community. I also do the workshop, like free workshop for people in different setting.
Wow.
I've been doing all around. One thing I will tell you is I've been like really trying to work with insurance company, so it's going to be more accessible. So accessible is important part of what I provide. However, it hasn't, my services hasn't been covered by the insurance, and it's just not me. A lot of other practitioners who do functional medicine, they have hard time because insurance are not really giving the reimbursement, but I'm working on it. I do accept HSA, FSA, those health saving accounts, and I do the payment plans. So I'm here, and it's my practice is telehealth. And if you wanna, visit the website, it's cherishimmune.com.
Wow.
Cherishimmune.com. And then you can get all the information there as far as the services and who we are and our vision and all those things. If you wanna email us, it's gonna be mayab@cherishimmune.com.